Most people don't want to get a diastasis when they're pregnant. Have you heard of a diastasis? That's where you get an abdominal separation and these two muscles start to spread apart and separate, creating a distance between the two six-pack ab muscles, also known as the rectus abdominis. Now, it can be that the tissue just gets thin there, or it can become really like sloppy and you can feel like you can just like push into a hole in your stomach. Well, this happens during pregnancy and we want to find ways to prevent it. And if you know that we're all going to get some degree of increase of separation, but we want that increase to recoil and fully heal postpartum. So to make sure you don't give yourself a clinically significant diastasis recti, meaning that you are left with these separated abs for the rest of your lives, we want you to follow these instructions during your pregnancy in order to help prevent this from happening long term. So here we go. We're going to dive into some tips, and I want you to follow every single one of them from the minute that you find out you're pregnant. Because if you can start doing this from the day you take your positive pregnancy test, you are going to start to change how your body is working and how your core is working, and you're going to be very protective of how your abdominals are going to be throughout the rest of the pregnancy, helping prevent any long-lasting stretch-out changes like a diastasis recti. So join me here, like and subscribe to this video, and we will give you all the content about diastasis recti and keeping your body safe during pregnancy so you don't end up afterwards with that mommy tummy or the abdominal separation and your belly can recoil after you have babies. All right, here we go. Tip number 1. Okay, so the very first thing that we want to start to do is when we get out of bed in the morning, instead of just crunching up and sitting up like this, good, come back down. That is going to put a lot of this separation energy onto the belly. So even if you're not showing yet, we want to make sure that you start to avoid doing that crunch up position. Because the ligaments are becoming a little bit more unstable and a little bit more flexible, they are going to separate more easily. The same is true for your tissue. You're growing a baby, a human in your belly, and these muscles are going to start to stretch out. If you stretch them by sitting up out of bed or sitting up off of a couch, you're going to create a lot more force of that separation, and we want to prevent that. So the very first thing you want to do is start changing the way that you get out of bed. And that's what we're going to do here. So the way to get out of bed is to simply roll to your side. So you're going to bend this knee here, push through the back of your heel, and roll towards the side as you get out of bed. Then you will drop your legs over the table and push with your elbow to get out of the bed, like this. That's going to take the pressure off of the rectus abdominis and the linea alba, which can cause that separation. So the more that we can start doing that preventatively, the better. Now, does that mean you can't do a crunch for the rest of your life? No, absolutely not. It just means that during pregnancy, we want to start to modify so we don't help increase that separation right away. There's a lot better core exercises that are going to take the pressure off the linea alba and prevent that diastasis from happening. The second thing that we want to do is use our breath when we start to move. So I'm going to show you in the same position when we're getting out of bed how to use that breath. But if we can use our breath when we're moving and decreasing the pressure on the belly, then that is going to also help keep the abs together and help prevent that separation energy. So what you're going to do is, again, you're not going to go into that sit-up position. You are going to roll over, but any movement that you do, you're going to exhale all of your air. So if this is an inhale, and then exhale the air, you exhale with an SH sound. That's going to activate the lower abdominals, but we'll get into that later. And simply just exhaling is taking the pressure off of these muscles. And then you're going to do the movement, or you're going to exhale as you do the movement. So you're going to blow as you go is what we call it. Blow as you go or blow before you go. You're going to find out what feels best for your body and what helps tighten your core better. So here we're going to go into it. We're combining these, the first tool I gave you, and this is the next tool, blow as you go. Here we go. You're going to bend this knee. She's going to exhale as she rolls to her side Continue the exhale and or reset if she needs to as she presses up and the legs fall off the table. That was the second tool. Number one, we had make sure that you are not crunching up out of bed. Number two, we're doing a blow as you go to help prevent that abdominal separation, exhaling all the air. The third tool I want to give you to help prevent the diastasis is this. When you are doing any movement at all, we want the lower abdominals to engage. And so the more that we can get the lower abdominals to engage, because they are lined up in this horizontal fashion, when they contract, they move in this connecting position that makes them shorter horizontally. And so why that's so good is it helps keep this more together. All right, so we're gonna go into doing a lower abdominal contraction, and this is gonna be a little harder to see if you're doing it right. We're not gonna like press her back flat into the table. That's not what we're doing. That's gonna be more of a pelvic tilt, and that can put downward pressure on the pelvic floor. So what we wanna do is just simply isolate this lower transverse abdominis muscle. And again, to do this, you might want to feel it and use your breath in order to get a stronger contraction. So I often will have people put their hands right here on their lower abdominals, and you're just feeling right inside the hip bone. And so it might feel like you're lifting baby up. You're lifting baby up with your muscles, with the lower transverse abdominis muscle. And as you do that, you should feel that your pubic bone here lifts up to your belly button here. So it firms and tightens, so you will feel your fingers pull in and up. And so nothing should be popping out when you do this contraction. If it's popping out, you're probably using too much of your obliques. If you're using too much of your obliques, that's gonna separate the diastasis and not be as helpful. Oblique strength is very important, but we want this contraction to dominate and to drive the movement pattern. So when you initiate moving your body, we want this muscle to be the initiator of the movement, because that's what's going to help prevent that separation. So here we go. We're going to take a nice deep breath in. She's going to use the SH sound as she exhales. Pulling in the lower abdominal muscle, that transverse abdominis muscle. You can see it pull up and in here. And she's using the exhale to get a little bit more activation here. She's using the SH sound, shh, just to contract those lower abdominal muscles. That is the third tip. So we talked about changing your movement. Then we talked about blowing as you go, and now we're talking about using your lower abdominal muscles to get a very good contraction to help you with your movement. So now let's use all three of those tools and go into a sit to stand. So like you're just getting out of a chair. Let's talk about what needs to happen in your body in order for you to go from even just a sitting to a standing position. So now all of us are going to go from sitting to standing when we're pregnant at one point or another. And again, we just want our muscles working for us, so we're not stressing our belly. Especially as we get really big, it can be like just standing up feels like so much effort. And so in order to stand up without stressing the abdominal wall, we want to engage the TA, and we want to exhale the air as we go to standing. So here she's going to do a sit to stand, and she's going to, as she initiates the movement, she's going to contract her lower abdominals, exhaling, and then stand. And then come back down. And so that's the pattern at which you want to do it. It sounds silly, but especially if you have round ligament pain, if you have SI joint pain, if you have pubic bone pain, you're gonna want to start activating this muscle to drive your movement, because that is gonna be what is gonna help reduce those pains in your body as you're pregnant, and it will also help prevent them. So not only now are you preventing diastasis recti, but you're preventing a lot of pain in the pelvis as well. So in this video, just to review, we went over how to prevent a diastasis from being clinically significant during your pregnancy. The separation is going to happen to the abdominal wall. That's present in the research, but we want to prevent it from becoming an actual problem. So we know that there's going to be some separation, but we don't want this separation to be a problem. We don't want these muscles not to go back to normal, because we all want our abdominal walls to go back to normal after we have a baby. And we want our cores to be nice and strong after we have a baby. And so these tips are going to help you get your core nice and strong and help prevent some of the weakness that can happen if you give yourself a diastasis while pregnant. So use these tips. Drop questions in the chat. Let me know what you want to know more of, or how we can help you through your daily life, especially if you're feeling any tension through your abdominal wall during some exercises. That probably means it might not be right for your body at this time. Every body is super individual and very specific, and so we can answer your direct questions as well. I'm Dr. Allison Felt. Thank you so much for joining me today, and I wish you a happy, healthy, pain-free pregnancy.